Hey, everybody. I want to welcome you to the Resident and Family Support Council meeting that we have on the second and the fourth Tuesday of every month at 3 o'clock. As you guys hear me say every single week, the link
They
that
are
you
going to
use,
see participants have received positive feedback.
the link that you used to join today's meeting is the same link for every meeting. So put that link someplace safe so that you can always access our meetings on the second and the fourth Tuesday at 3 o'clock. And we do recognize that not everybody can always make it at 3 o'clock. And so we do record these and then we put them on YouTube. And I will have my cohorts in the background starting to put things into the chat. So you'll be able to see the link for for the videos on YouTube, as well as the links for how to get in touch with an ombudsman if you need to get in touch with an ombudsman, and all those other great links out there. So Steven's working his magic in the background. I see him popping in the chat right now. So make sure you visit that chat throughout the session because we do have people working in the background that start to put stuff into that chat that's very timely with the conversations that we're having. So I just want to remind everybody a little bit about what it is that we do here. The Illinois Pioneer Coalition actually allows us to have these meetings by letting us use their Zoom account. We do not have a Zoom account through the Ombudsman program on the Department of Aging. So they've allowed us to use their account because we've recognized that Zoom is something that's become very customer friendly for the general public throughout the pandemic. So the information and anything that we've been able to use has always been through the courtesy of the Illinois Pioneer Coalition. So thank you very much to the Pioneer Coalition for that. And just to let you know who I am, because I have a tendency to forget that, I'm Lee Moriarty, and I'm the Deputy State Long-Term Care Ombudsman. And we as Ombudsmen advocate for those who live in long-term care communities. And that's what brought us to these meetings. We've been doing these meetings for the last 5 years now. We're almost at our anniversary date. We have 95 videos on our YouTube channel, which we're very excited about. And I want to encourage everybody to visit that channel. There's a lot of information on that site. And like, for example, today, I got a lot of feedback from people saying, oh, I want to be here, but I can't be here today for today's meeting. So I can always direct them. It'll be on YouTube. Don't worry. You'll be able to see it there. So know that we have that for you. And like I said, as the Ombudsman, we advocate for those who live in long-term care. And we recognized that one of the things that people need in order to be able to do a better job of advocating is information. So that's what this meetings are always about, is to empower people with information so that we can navigate that aging path in a better manner for ourselves or those that we love. And which brings me to Michelle today. Michelle is actually going to share with us something that's really exciting about the Department on Aging and what it is that they've been doing. And Michelle, if you'd like to go ahead and unmute yourself and just start telling us a little bit about everything, because we're getting a very good response today to this topic. So we're excited to hear from you. So thank you for joining us.
Fantastic. Thanks so much, Lee. I really appreciate the invitation, and it's good to see some friends in the audience here as people are popping on. I'm going to go ahead and share my screen. Great. There we go.
As she's sharing, remember, if you have any questions, don't hesitate to put them in the chat, or you could raise your hands because that's what we've got. Stephen there, he's monitoring all of that for us so that we can make sure we get those addressed.
Fantastic. Can you see my screen?
Yes, we can.
Fantastic. Well, good. You'll see me looking off this way a little bit, just my screen, and so I apologize for that. I would move it over. I should move it over, but alas, it's going to be a little more challenging. So anyway, my name's Michelle Hoersch. I am the Chief Planning Officer for the Illinois Multisector Plan on Aging, now called Engaging Illinois. I'm absolutely delighted to be here. I'm based out of the Illinois Department on Aging, and I like to read this because I think this grounds me in the important work of the department, as well as it is such a logical place that the Illinois Multisector Plan on Aging is based. The Department on Aging is to serve and advocate for older adults. I mean, when I hear Lee describe what the Ombudsman program does, I don't think anything could describe it better. And to ensure that there's high quality and culturally appropriate programs, and to promote partnerships and encourage independence, dignity, and quality of life. So I'm delighted to announce the release of Engaging Illinois. It was launched on January 15th, 2026. It was put together. It's been a long time in the making, and I'll give you a little bit of the background on that so you know how we came up with everything. But so you can see the cover right there. And I think the cover of the plan speaks volumes. It's forward looking. There's nothing stagnant about this. This is about the beauty of working to empower aging and those who support individuals who are aging. So I really want to say special thanks to a number of organizations. Certainly the RRF Foundation was very supportive in making sure Illinois was able to get this program off the ground, even to the extent of loaning us their senior program officer, Serena Worthington, until the department was able to hire me to take over, and she passed the baton very graciously to me. And I started in June of last year, hit the ground running because we had a lot to do to get this plan up and running. A lot of legwork had already been done by Health and Medicine Policy Research Group, their Illinois Aging Together Coalition, who had done work across the state, listening to individuals talk about what they needed to age well. And they compiled information from literally thousands of conversations and meetings across the state, which laid the foundation for the plan. I want to acknowledge our research partner, University of Illinois, the School of Public Health, and the Institute for Research on Race and Public Policy, as well as the Center for Healthcare Strategies, which has been a driving force in making sure that all of the MPAs, as they're called, or multi-sector plans for aging from across the country, have a place to share information and work with one another and learn from one another. It's very much of a peer collaborative. And on that note, the multi-sector plans were developed. The first one was out of California, and then Massachusetts, and slowly we've been filling in the center of the country. And so we are still in really the early waves of being one of the first waves of getting a multi-sector plan on aging, and it's just so incredibly logical. I want to also acknowledge the Illinois Assistive Technology Program. They have worked miracles trying and making sure that the plan is accessible to all, as well as Reframing Aging, National Center for Reframing Aging, which, and I'll talk about that a little bit more in a minute, but they were central, as well as SCP, which is our communications partner. They helped us develop the plan, format the plan, and make really user-friendly communications going forward. We couldn't do this without our Community Advisory Council, consisting of 25 people appointed by the governor from across the state with expertise in all areas of aging and caregiving, as well as the Interagency Task Force, which consisted of multiple agencies and departments across the state, because aging is not just one area. It's so multidimensional. And so we needed to have conversations and have the active engagement of housing and transportation and health and social services and healthcare financing and so on. And so delighted that all of those individuals were active participants. So the plan. It's Governor Pritzker's response to recommendations based on the Illinois Aging Together Coalition. Based on that, Governor Pritzker had made an executive order in August of 2024, and that included the establishment of the Interagency Task Force, the Community Advisory Council, and to hire a chief planning officer, which is me. It also laid out that this would be a 10-year blueprint for aging well in the state. It establishes priorities and policies and programs for how we're going to do this. It requires partnership and collaboration, which are really key. It insists on reframing aging. So instead of a needs-based, it's an asset-based lens to looking at aging and considering aging, as well as equity and inclusion are absolutely embedded throughout. And that was something that Director Killow made perfectly clear, even in my first interview, is that equity and inclusion would be very central to the development of this plan. And well, reasonably so, and that made perfect sense. Some of the core messages is that this is all about all of us. From the moment we're born, we're aging, right? That's good, beats the alternative. And so as we're aging, it makes sense that healthy children become healthier adults who can become healthier older individuals as they age. And so it is about all of us. We all contribute in one way and benefit in other ways through this plan, particularly as we really roll it out. It's now a month, not even a month old. As I mentioned, we launched it on January 15th. So the plan is very, very new. So you probably have not seen anything come out of it yet, but stay tuned. There will be a lot, and we're asking for all of you to actively participate. As I mentioned, it helps us reframe how we think about aging from not about frailty and needs, but about active engagement and setting up the right conditions so individuals can age with dignity and respect and continue to contribute in the meaningful ways that they always have been and may want to continue doing. So we want to get out of people's way if they want to continue to work, if they need support for housing. We want to make sure that that's all in a very dignified and respectful manner. So that is what the Reframing Aging is all about. And I encourage all of you to take a look at the Reframing Aging website. It really is very inspiring. It really does truly reframe aging. And I am so grateful for their participation because it really is very meaningful and very deep. The plan is also very ambitious, but it's realistic. And it presents a roadmap for the future. There are some things in there that when you read it, and I'll go over these in a little bit, that are some low-hanging fruit because we never know what the budget situation is going to be. And so in lean budget years, we have to be able to move forward. We can't have everything be expensive and highly aspirational. There are some things that we're going to get done by sheer will and collaboration and coordination. And isn't that how all important things get done? It's because people work together. And so the plan, it does have a lot of ambitious elements to it as well. But as I said, ambitious but realistic and achievable, and includes a wide range of strategies, as I mentioned, to address critical disparities and needs in the state's aging population. Because by the year 2030, we'll have more people over the age of 65 than we will under 18. And those demographic shifts really have a huge implication on all aspects of society, how we look at housing, how we look at transportation, how we look at care and services. And so if have a frame of reference that the population is shifting, then we will act accordingly. It also breaks down silos and requires something from all of us. Before I was with the Department on Aging, which is work I absolutely adore, I was with the U.S. Department of Health and Human Services for nearly 30 years, leading the Office on Women's Health. And in that space, what I did was work across all the different agencies. So this work comes very naturally to me. I don't like staying in my own backyard. I like playing in everybody else's and getting everybody else engaged. And that's really what we have to do because people's lives are complex and multifaceted. And so we need to be able to coordinate and break down those silos and at least bridge them for now. The plan is also really innovative and future focused. And I think you'll see that in some of the work that I'll describe in a minute here. So there are 4 focus areas in the plan, and they include creating livable, connected communities, ensuring health for all ages, investing in caregivers, and affording aging. And let me get into a little more detail about each of those. So creating livable, connected communities is both the physical infrastructure and the social infrastructure. We want to have age-friendly neighborhoods. We want to make sure that housing is secure and stable, that transportation is appropriate and accessible and gets people where they need to go when they need to get there. That there's a social engagement and community connection. So within this focus area called Creating Livable Connected Communities, we have 5 strategies and 35 actions. And our actions, as I mentioned earlier, are broken down into short, medium, and long term. And some of them are going to take all of us rowing in the same direction for a really long time to get there, but we will get there. Others are just going to be the opportunity to collaborate and coordinate is really all we need. And those will be wonderful milestones to be able to say, look, we did this just because we wanted to and we cooperated. So that's the livable, connected communities. The next focus area is called ensuring health for all ages. And so that's about not only promoting and preserving health, but also healthcare, right? With respect to promoting and preserving health, we've got a big prevention focus, a lot of health promotion, and healthcare education for older adults. With respect to healthcare, we want to educate all providers of all different stripes to understand the issues related to aging. In many residency programs, or in residency programs across the country, almost all require a rotation in pediatrics. Almost I think 93% of residency programs require that the students go through pediatrics rotation. Only about 7% require geriatrics. Now with this shifting population, we're really going to have a very different situation. We need to have everybody understand what the issues of geriatrics are. It's very important to understand pediatrics, where we came from and how we developed, but we also need to know where we're going and the implications for that. So healthcare is going to be really critical. We want to make it accessible. We want to make it aging appropriate. We want to make sure there's good care coordination. Who wants to have to figure everything out by going to 25 different websites and having to make a million calls? I myself have gone through that when I was caring for my brother. It's amazing what we have to go through to get what we need. And so the more we can coordinate, the better. And as I mentioned, health professions education, we want to make sure that social workers, nurses, community health workers, physicians, everyone understands aging. And also we're going to have a focus on hospice and palliative care, and also expanding the workforce, because we need a whole lot more people who are going to have to be interested in this work. So the next focus area is called investing in caregivers. And we're looking at well-being and resources for paid and unpaid caregivers. So many people don't recognize themselves as caregivers, yet there are so many demands and there are so many challenges related to that, and so many gifts that come from being a caregiver. But most people, as I said, don't recognize that they are themselves caregivers. And so it's really important. They think, oh, I'm just taking care of my dad, or I help out my neighbor. But really, we want to get to the point where people identify that they are caregivers. And then if they start wearing that hat and recognizing it and wearing that badge of honor, they can also start recognizing that there are services and supports out there that can really help them, because burnout is real in the caregiver community, and poor health, and also, financial challenges. Somebody shouldn't have to make the choice between caring for a loved one and compromising their economic security. It's interesting because caregivers also feel very isolated, and yet there are so many millions of caregivers across the country that we really need to develop peer support, so you become more part of a group of caregivers than an island. And so that is an important part of investing in caregivers. In that focus area, we have 6 strategies and 28 actions. And finally, the fourth focus area is called affording aging. We want to make sure that people can age in place or age in community. And we want to look at funding and availability of home and community-based services. I think that's one of the most beautiful things about the Department on Aging, is that the people who work in aging are the most tireless advocates for individuals. And it's beautiful. And I feel it's a real privilege for me to work in this space, because I've been in public health for over 3 decades, never met a group who are consistently driven, focused, and absolutely tireless in advocating for the people that for whom they represent and work for. So in this space about affording aging, we're also going to look at affordable housing, obviously a huge issue across the country. And we've got lots of experts who focus on housing, who are part of the Engaging Illinois Commission. We want to make sure that people are prepared financially to age well. And so that starts way upstream. That's when you're in high school, you should start thinking about these things. And not everybody has that kind of disposable income and we shouldn't think about saving for retirement as disposable income, but that's a reality. Not everybody has a lot of money. So to be very forward thinking and prepare from the earliest stages is really very key. We want to promote retirement savings to the extent possible, and also do a lot of employment training for individuals who want to either pivot in their career and do something else, or want to continue working but want to get out of. We want to get the policies out of their way that prohibit them from doing so. I was in Rockford a number of months ago listening to folks talk about what they needed in terms of aging supports, and also how they want to engage and what they want their retirement years, their aging years, older years to look like. And one of them, there was a nurse, retired nurse. She said, "I would love to go and teach, but if I do, I jeopardize my pension." And so we got to get out of the way, because we absolutely need these seasoned professionals to help cultivate the next generation of providers. So, and there's policies that just don't make sense and are antiquated and need to be addressed. So that's part of what we're looking at in terms of reporting aging. Next focus area, there are 5 strategies and 23 actions we'll look at. There are also 3 special initiatives. When you think about the 4 focus areas, you're hard-pressed, at least I'm hard-pressed, to think of something that doesn't fit into one of those, right? So we are really looking at the holistic nature of individuals' lives as they age, and caregivers. But there are a few that didn't fit neatly into any, and so they really are the overarching ones. One of them is called Engage Central, and that's going to be a web portal that will, it will have so much eventually. It's going to take time to build. As I mentioned, we needed to be prepared for very lean budget constraints in years where there isn't much in the way of fiscal flexibility. So we are planning, and we move forward with what we can do as we can do it. And then as we're able to, we're going to build out this Engage Central website, which will also, it'll be the Illinois Aging Resource Center, but it won't just be aging resources. I mean, everything's an aging resource, right? But it's going to pull together information and links to other websites and other resources for housing, transportation, social services, you name it. Food security, whatever, and the caregiver portal, which will help caregivers navigate the important work, the essential work they do. And so over time, we'll build that out with, I would love it that Lee mentioned that she's got 95 podcasts or 95 webinars that they've got on YouTube. That's remarkable. And so we'll make it a repository where we don't take over anybody's website. We just link to all of them, because there's great information out there. And one of the things that I've heard over and over since I've started in aging, my mere less than a year ago, was that some of these certain resources and services are the best kept secret. And that's what we're really looking to do, is to make sure that is not the case. I want to make it my business that everyone understands what's available to them and knows how to access it. And that's what Engage Central is all about. A second initiative is about modernizing home and community-based services. And that's more of a policy, internal, structural issue to make sure that when people qualify for services, they qualify for the right services and aren't given too much or too little. And people don't work the system to qualify when in fact, they may need fewer services, but should be eligible with fewer services than having to qualify for this whole range of services that they really don't need. So it's really about making services align more closely with individuals' needs. And so that is very much of a transformation in the service delivery and also data infrastructure. And finally, the third initiative is a statewide academic collaborative on aging. This is not just, it's going all universities, colleges, and community colleges. And I am very intentional about community colleges because they are really core to building a workforce and delivering care and services. All the universities, colleges, and community colleges in the state of Illinois will be invited to participate. And it will be what these academics decide to make it. There can be sharing of curricula, and we will encourage that. We'll help quickly be able to translate research findings into programs, policy, and practice. There may be a lot of information that flows related to, identifying needs and translating those. I just think the sky is the limit, really. And it will also include creating age-friendly healthcare systems, and not just healthcare, but what I envision is that I'd love to see architects from across the state and from a bunch of institutions recognize that they need to design buildings and facilities differently, and parks, and you name it. The transportation needs to be designed differently, and so on. Community, urban planning. And so this is really going to be a place where we speed up the ability for information dissemination. So I'm very excited about that one. So those are 3 of the special initiatives. We also have 10. We have 10 priorities. If you get a chance to look at the plan, and I do encourage you to take a look at it, it's very readable, and we did that intentionally. Director Killo of the Department on Aging insisted that this be a really short, succinct document that was user friendly, and we set out to do that. And I believe we were I think we're quite successful, because say you're interested in healthcare, you can flip right to the healthcare section and the health section and look at information, and you will have a good context there. And so, but we also wanted to make it accessible for legislators and for other people that we want buy-in. And so we have 10 priorities. We want this to be useful and responsive to anyone who wants to use it. So among the 10 priorities, as I said, we have how many actions and strategies? We had literally over 100 strategies. Over 100 actions. But some of our 10 priorities, just to kind of give a context: Engage Central, that resource center that will help people navigate the care and services; making Illinois an age-friendly state, not just a state, but age-friendly communities, age-friendly healthcare systems, age-friendly businesses and workforce, and business labor community. That new housing models be focused on to increase accessible and affordable housing. We want to bring to life the older adults in the Blue Ribbon Commission on Transportation Infrastructure. Healthy Illinois is out of the Illinois Department of Public Health, and there's so many excellent priorities, and they're ranging from falls prevention to social connection and everything in between, chronic disease, you name it. The training of the geriatrics workforce to make sure that there's age-related topics in that general healthcare workforce. So you don't have to be a geriatrician or a gerontologist to be knowledgeable about the issues of aging. Also, the caregiver awareness, as we talked about a little earlier. Financial education and understanding eligibility for different supports and resources. Home and community-based services modernization, as I mentioned, as well as the statewide collaborative. So if you were to say, what are the top 10, those are among the top 10 issues that we will be focusing on. That is not in any way to say everything else isn't of critical importance, but those are some things, hooks you can hang your hat on. So moving forward, implementation starts now. It started as soon as we pressed send to send it into the governor's office and the General Assembly, and on January 15th when we launched it to the public through press release information. So what are we doing? Right now we are gearing up all of our work groups. We will have a governance structure that is called Engaging Illinois Commission. It will consist of many of the same experts who were on the Community Advisory Council, as well as leadership of departments across the state of Illinois that will focus that will continue to do the important work and participate in Engaging Illinois. We will have at least 9 action groups. So each of the focus areas will have an action group, but creating livable, connected communities was just too vast to just have one working group, because it's so much, there's so many focal areas. So in that, in addition to affording aging, investing in caregivers and health, we will also, for creating livable, connected communities, we've broken that into focused on age-friendly communities, housing, transportation, and social connection. And I think all of those resonate so much with all of us. And I would love, love, love to have your active engagement in these work groups. There will also be ambassadors that will help, will be kind of the first to know as we have new information that we're sharing. Ambassadors will be volunteers who want to make sure that their communities are well informed about what's happening through Engaging Illinois. And so they can bring all the resources and services to the people that they serve and interact with. So as I mentioned, there's participation in every turn and every opportunity. Some of the resources that we have right off the bat, the plan. And again, please do go. There's a link to it in my slides, but also I can put it in the chat later. I'm not good at walking and chewing gum, so I won't try to do it now while I'm talking, but we will get the link into the chat for everybody for Engaging Illinois. But if you just Google Engaging Illinois, you will get the plan. And the website, we've got kind of our fledgling website, which will continue to grow every day. We have a sharing kit. So if you are part of an organization or community, we have, and everybody's part of some community, we have social media posts and images. We have the press release. We have talking points about the plan. Because the more we talk about it, the more people get engaged and see a place for themselves. And coming soon, we will have a newsletter, and there is so much more to follow. What's really fun is that so many of my colleagues in the department have taken on real leadership roles in this plan. And, they're planning academies on resources and how to roll out good information and how to make sure people know about financial literacy and so much more. And so who knows what's to come, but I'm very excited about it. And there will be lots, and it will be interesting. So how can we bring together the plan? How can we work together to bring this plan to life? There are many ways. Again, this is a quick link to the plan right here. There's so many ways we can each take action, because this isn't a plan that is coming down from on high. This is a plan that needs to bubble up from the streets. This is about everyone rowing in the same direction. And because collectively we can do so much. I mean, you see it when people take public action and collective action. That's what moves things. And so while the state has made a huge commitment to aging in the state and also a commitment to Engaging Illinois, as have lots of other departments, we all can do it as well. And if we're all coordinated, we get there a lot faster. So please do look at the plan. And then I ask you this: what's your vision for making Illinois the gold standard for aging and aging well? So just give that a little thought. And what focus areas are you most interested? Are you a housing person? Are you a caregiver person? Are you really interested in financial literacy or health? When you look through the plan, look at what strategies align with your passion and where do you have leverage? And all of us have leverage somewhere. We may not think so, but we do. And so maybe it's figuring out how to reach your state senator or state representative to talk about issues of importance. Maybe it's with employers. Maybe it's with your municipality. But there's always a place that all of us can act to make a difference. And so which actions can you help advance? And there are lots of them. And if you want to do something that is not as specifically articulated in the action, go for it. Anything that works to improve aging for all of us is absolutely the right thing to be doing. And who else could you invite to the table to help you move in that direction? Are there people in your organization not typically involved in this work who could or should be? And what are some next steps you can take to put these actions in place? And if you ever have some thoughts that you want to talk through, call me, email me, get in touch. There's nothing I like more than grassroots movement for this plan and for good causes. So if you're interested and want to stay informed, please connect with Engaging Illinois. I'll make sure that you all get these slides so you can connect and get on the mailing list for the newsletter, etc. And so then I just want to thank you. I want to thank Lee and Kelly for inviting me today. It's an absolute privilege to talk with all of you. And if we have time, I'd love to field some questions. Lee, is that doable?
Absolutely. We'd love for people to ask questions. And well, one of the things that first came to my mind was I would love to people to either put it in chat or do feel free to raise your hand. But out of everything that Michelle shared with us, what spoke to you the most about what it is that she shared? I'm interested for this group because I'd love to be able to also structure some of our future resident and family support council meetings around some of those topics. Because I see this, Michelle, as a great avenue for being able to get some engagement from people that attend our meetings, whether it's just you need to get information out there throughout as the plan is evolving and moving forward. This is a great forum to be able to do that. Or if you're looking for feedback about a particular topic area or something like that, this is a good group for something along those lines. I
Yes,
see you
it's
do have,
very active. I mean, we've
yes,
got 82 people on here. This is
yes.
fabulous.
This is a good topic that people want to know. What is Illinois doing to support us as we're all aging, right? I mean, because this is something that we hope we all get to do, because if we didn't get to do it, that would mean that we were not around. So we all pray that we get to be able to age well in Illinois. And we need to make sure that this is happening well for us as well as for those that we love. And that we care about. So I see one hand raised so far, and that's Carrie. Carrie?
Hi, Carrie.
Hello, hi Michelle. So first of all, I want to thank Lee and Stephen because they kept my crazy idea alive. I went to Kelly 5 years ago and said we need to do this, and
Ah,
and Lee and I did it. We started it, and I got busy with other things, and Lee kept going. So I am very grateful that it is still going. Because we've done great work together.
Hmm.
We still do. And obviously, Michelle, we met briefly. I don't even remember where you and I need to connect. It's like sooner than later. Um,
okay.
there is so much that can be done with this. Um, and looking, once you start bringing the communities in, it's what I tell people, why are we building homes and putting them somewhere and not bringing the community into it? We need parks in them, we need coffee shops, we need things that will make it become the community center everywhere we go because it's better for everybody. The other thing is, which I was because of something you said, I have a somewhat friend, business acquaintance in Canada who teaches a class that is half elders and half students. And they've done multiple semesters with incredible results. So as you're looking at how, and I can introduce you.
Thank you. I would love that. That totally caught my attention. Did you see that I got my pen and
Yes,
started writing?
well, and even, when I heard you speak last time, it did at least get me going because like I joined the advisory board for the local AAA in my area. So,
Right.
we all, and that's the thing is getting people involved because I can tell you if I can do what I've accomplished, anybody else can do this. I was a mom who knew nothing when I started. So you
Well,
just have to jump in feet first and just go.
and one of the things that I will share is that last year we did a lot of resident interviews to find out what life was like for people and find out the needs and where we, what things, how is life really for those who live in long-term care. And this year we're focusing on the support of the caregiver and of those families and friends. And we're interviewing people for that have a loved one in long-term care or have had a loved one in long-term care. And I will be interviewing Carrie in March. So I'm excited about that opportunity. We did one previously, and that was a couple of weeks ago. And so you can see that on YouTube. And it really is really cool to get lessons learned and best practices and all that from each other. And that's what these meetings need to be about is that sharing. So that's one of the things that I appreciate about this meeting. Donald, I see you have your hand raised. Would you like to make a comment or ask a question?
Absolutely, Lee. Thank you so much. Good to see you. Good to see everybody.
Yes.
I'd like to speak from my position as the chairperson of the Illinois Commission on LGBTQ plus aging and long-term HIV survival. First of all, I want to compliment my colleague, Michelle, who does this presentation, and every time it's fresh and authentic because her heart is really in this project. So you've hit the ball out of the court again, Michelle. But I want to speak about Engaging Illinois as an ally to every one of us who's part of a community that we perceive to be marginalized or overlooked or stigmatized or whatever. This project represents a commitment in the state of Illinois that we are going to remove those social silos that separate us so that we are all one people receiving all the same quality of service and support for the general health and well-being of all Illinoisans. And that's a great thing. My commission will sundown in a year, but our work, our hope, and our hope for continued legacy lies with Engaging Illinois. So there's room for everybody. Come on in.
That's great. That's, yeah.
Well put, Don.
Yes, very well put, Donald. And to know that there's many, to know that actions can continue to happen, and that one of the things it does feel that we do very well is silo ourselves. And we need to stop doing that. We need to bring ourselves together because many issues that people face, they might be facing it in a different way, but they are facing it. And so that's what's so cool about this, the Engaging Illinois, because it's separating those silos and bringing things together. It's looking at all aspects of aging so that we can do it well. Brittany, I see that you have a question.
Yes. Hi, everybody. My name is Brittany Jeter. I'm the founder of Young 60 Plus Club. It's an adult day service here in Matteson, Illinois. I've recently joined the Department of Aging and Department of Rehabilitation Services for care for the seniors. And I just want to mention how I've just seen where there may be, like you guys mentioned earlier, a disconnect of utilizing adult day as part of home health coverage and preventing caregiver burnout. I'm seeing there's not enough information in regards to educating the case managers or people having the experience. Out here, there's 20 years of experience of home health, but then the caregivers get burnt out, people are being rehospitalized. And so when you mention that financial part or the community resources, I just think we have some things in place that are not properly used to assist with some of the care programs that we do have. So I think we just need to use those more effectively as a collaboration care for home health and adult day for seniors to stay more in the community. And I think that's something that we should really work hard on. And hopefully there's some people online that can actually, assist that movement.
Brittany, I think that you make an excellent point. And I would love it if you see, or I'll make sure I put my email in the chat. If you could articulate like who specifically, like let's get down to, the real nuts and bolts of what you're suggesting needs to happen. And I can't promise we can get it done immediately, but at least if, the awareness is huge. And then you start getting people who are interested and have those same concerns and ideas. I think that's really powerful. So I will put my information in the chat and please email me liberally. If you can say, in the subject line, MPA suggestion or details or anything like that, and then really describe who you think needs to come together, I would really appreciate it.
There is a question in the chat, Michelle, from Jean. How do you see dementia-friendly communities and villages fitting into this plan?
Oh, beautifully. I mean, I wish that, that was a great question because villages keep coming up, as do dementia-friendly. Dementia-friendly to me is naturally linked to age-friendly. We want to make sure that there is truly dementia-friendly opportunities everywhere and communities everywhere. And so we're really building on those. Those are really working collectively together. As for villages, I have been hearing about the villages. And again, I mentioned that I'm relatively new to aging, very steeped in public health and women's health. But aging is, I'm learning like drinking from a fire hose, to be honest with you. It's really great though. And so I'm meeting with the Villages folks. I have like 3 meetings actually in the next couple of weeks, because what a cool model. And what I've heard some people say, oh, well, it requires some money. Well, isn't there a way that we could do it and structure it in a way that it wouldn't be so burdensome financially? And I'm sure there is. And I'm sure there are people doing it. The thing with Engaging Illinois is people out there have the answers. We just need to raise the visibility and awareness of these answers and be able to replicate and scale. And so I'm very eager to talk to the Villages folks in the next couple of weeks, learn everything I can, and see what we can do to leverage them to get them. I mean, wouldn't it be cool to have a village in every community? That just seems so logical.
Mm-hmm.
Thank you for that question.
There is another question from Jean as well. The problem is often finances. Are there any funds to support this initiative?
Talking about a lean fiscal year, you've all heard, that a lot of the issues at the federal level and decisions in Congress and through the White House have impacted the funds that are available to states. It is a very, very lean time for states. That's why this is a 10-year plan. Okay. So we may need to be pinching pennies now, but that means that we are working hard to figure out who those partners are who may not be as fiscally impacted as the state is this year. Who do we partner with? And what can we get done without a lot of funds? But yes, there are some funds to make sure that there's that we can convene these groups, that we can make sure that the website continues to evolve, that we can get materials and resources out there, that we can do training and education. So right now, it is a smaller amount of money, but the state, I have to give it to the state and the governor. They put their money where their mouth is. And not only is there some support for Engaging Illinois to continue to evolve, but there's really great support for housing. Never enough, right? Never enough. Will there ever be enough? But I don't necessarily think that all the solutions need to come from, as I mentioned, from the federal government or the leadership in the state government. It percolates up from the grassroots effort. So yes, there is a financial commitment. Is it as much as we would like? No. We'll never have as much as we want, because we have nice homes with yards and dogs for everybody. Dogs or cats. So there would, and everybody could be driven to their appointments. That's the utopia. So until we get there, we just continue to keep working and partnering together. But yes, I do want to say that the governor and the General Assembly have made this a priority, and the lean fiscal years will be balanced by having longevity in a 10-year plan.
Thank you. Also, Carrie, I think I'm not sure Brittany or Carrie had their hand up first, but Carrie?
So one of the things, that is overlooked very much is IDD adults that are aging, especially with dementia. And, the IDD community does not know how to deal with them, no matter what they're saying, because I see it every day. And nobody's plan, and it's not just Illinois, nobody's plan addresses it across the country that I've seen. And, part of it is because they've been siloed apart for so long, where there never was a reason to be siloing them. So getting elders, I'm sorry, if somebody's got dementia, they've got dementia. If they need a memory care, they're going to be better served. But everyone's like, oh, because they're development delayed, they're scared to bring them in. You look at that, and even when you were talking about your 10 years and the different fundings, that's why you and I need to talk, because it's something we're telling people with the national thing that I'm working on, is you have to get creative and look at where does your community sit and what funding will work for your community. I tell people all the time, okay, if you're in a rural community, it doesn't matter what state you are in, go look at FDA funding. It's a whole different thing that people don't. So those are where things like what you're doing are going to benefit people, because they need this broader picture to understand and need to learn what to look at.
That's a great point. And that was something that was very intentional at the outset. And even in the executive order is about bridging the chasm between disability and aging, because there are so many similarities that there would be siloed or parallel paths that don't link up. Doesn't make sense. And the Grant Makers and Aging Conference in October was really great. They put at the forefront for a philanthropy that focuses on aging that there should be attention, that you should partner with the disability community, because it's better than competing for crumbs. If we work together, there's so much more that we can do. And so I completely wholeheartedly agree with you and look forward to having conversations with you.
Right. I mean, I'll happily co-chair something if you get someone to do this.
Love it. Love it.
Okay.
Send me an email, please.
I will send you an email.
Okay. Fantastic. And I was just picking up the plan because I always have, you can't really see it here, but
Yeah.
I always have the plan like within arm's reach. And one of the things in the plan, I hope you do see that there's a lot of mention, and not just mention, but it really being intentional about integrating the disability community in our work. So
Okay.
we got to bring it to life now, Carrie. You and me.
Yes.
So,
Yeah.
all right.
There is another question in the chat. The latest dementia research is advancing techniques called utilizing emotions for therapy. I'm currently focusing on positives in communication and interaction. Has anyone seen that applied? Sounds like this person needs to be on one of your committees.
I think
Sherry?
so.
Sherry, I think you
so.
need to, yeah, I think you need to get involved in this, because it sounds like you've got your pulse on something that could be important to dive into a little bit.
I would love that. Did you say Sherry? Sherry, I don't see you on the screen,
Sherry. Yeah.
Okay. Sherry, you've got my email. I put it in the chat. Please email me. I would love to hear more about this. And if this is a good model, that's the whole point, is that no one has all the answers, but collectively we do. So please get in touch with me.
Yes.
And sorry, go on.
She went on and said, supported funding for individual and or group prior activities and hobbies still doable, frequently emphasizing art, music, and any key talents, as well as development of new skills, open doors to future later life would be most appreciated. Has someone heard of any tools, resources, not just the government's assignments of large cash outlays, largely for aid or new buildings? So it sounds like there's a lot that that Sherry may have to offer. And Sherry, do feel free to unmute yourself if you would like to add to the conversation. I do want to recognize Lindsay with her hand up right now.
Okay, can I respond really quickly to
Absolutely.
the conversation about social connection is such a central part. The research is definitive for people who have good social connections, and it doesn't have to be a lot. It's not 50 friends. It's like one or two people that you can call and you can count on. And to cultivate that is so critically important, because you get 7.5 years of high quality life out of having those social connections. And that's not easy for everybody. That doesn't mean it's impossible. I mean, even fora like this is really good, because I bet people are making connections here in the chat, oh, I'm very interested in that. Let's talk about this. And so we really do need to work on enhancing every opportunity we can for social connection. But to that point about the arts, one of the people who I chased down to be on work on this work, her name is Teresa Davis, and she's with the Illinois Arts Council, and she is a force of nature. And so she wants to bring the arts into communities in focusing on aging and disability, so to build social connection and community cohesion. So I'm so eager to see her ideas and, to help bring those to life. So the arts are a wonderful place to do that. So.
And I see Teresa turned her camera on so we can all see her. Hi, Teresa.
Oh, is she here? Oh, that's fun.
She is here.
Yay. One of my heroes.
Yes. And I'm a recreation therapist by trade. So I actually am right there with all of you. Social connection, all of this, using the arts, using dance, using anything, any means that we can to be able to promote well-being, I think is extremely important in our world. And it doesn't end just because we're getting older. definitely doesn't end. Lindsay, did you want to go ahead and unmute yourself and ask your question?
Um, my question is more of a comment.
Uh-huh.
So I'm a part of the Humanized Long-Term Care campaign, and what we are advocating for is a housing voucher for people to get out of facilities that might not have any income. Um, it works for anyone who's in a facility or finds themselves in a facility. Um, the goal would be to get people who are able to move out. So I'm not talking about memory care um, and um, like dementia type things, but people who have disabilities or elders um, who can maintain on their own with supports are able to more quickly than right now is done with Colbert, Williams, and Legis. Um, if you want more information, feel free to contact me. I can put my email in the chat. Um, but this
Actually,
is
if you would email me with your information, that would be extremely helpful. And because we do
okay.
want to collect all the models and all the good ideas. And certainly as you read the plan, and I hope you do, is that you'll see that front and center is having people be able to age in their community or in their home, not in their home, in their community in one way or another. Keep them closer to their social support network. So yes, please get in touch with me. Share that information. I would greatly appreciate that.
So the
There
way
was a
that
question. Oh, go ahead. I'm sorry, Lindsay. Go ahead. Continue.
the way that this would be funded for anyone who's interested is adding a quarter to the real estate transfer tax. So that doesn't sound like a lot, and it isn't. It's like $150 per $300,000 home. But you add all of those quarters up, and you end up with a fund that could move out people into the community.
That's
So
very
that's why this is kind of a better idea than some of the other ones that we've thought of.
good.
Yeah, that sounds like a really cool idea.
It is. It's that kind of local genius that moves things forward.
Absolutely. There is a question, and I have the same question. To provide more information on the role of the ambassador.
To come to a theater near you soon. I don't have that information yet. I am busy spinning up the work groups at the moment and the overall committee. That is a very near term focus area, is what the ambassadors can do. I would love to hear from all of you. How do you think the ambassadors can work? So please, I would love to hear from you, because I don't know. I mean, I have my ideas. I've had one of my research assistants do some research about other places, but you tell me what folks can do. You're the experts. So please, you've got my email, use it liberally. And just in the subject line, just tell me what you're thinking, because I would like to have the ambassadors be, kind of one of the most effective tools and one of the most effective groups and assets of engaging Illinois is by using grassroots efforts. So please tell me what you think. I mean, certainly vehicle for sharing information and getting it out to people, but there's so many more opportunities, and people have wild, great ideas that just need to be socialized. We just need to hear about them and share them. So please share that information.
The families in. The families are a big, big part of what needs to fix this system.
And so are the people who who are living who are aging. I mean, I think that's a really important, because there's so many stigmatisms around stigmas around aging, that ageism is an ism, and it really is. There's so many negative just PR around it, and we need to
Yeah.
reverse all of that because I'm telling you, I'm old and I'm not gonna, I don't want to, I'm fighting those stereotypes.
Well, it's a lifetime of wisdom and experience.
Yes.
You can't teach that. You live it and you grow into it. And so if we don't think of the aging population as one of the greatest resources, we're missing the boat.
Yes. Well, we're at our 4 o'clock hour, and there is a last question about the slides. Michelle, would we be able to put the slides onto our website?
Absolutely. Absolutely.
Okay.
Yeah. I'll
So
send them
you
to you. If you will post them, that would be fantastic.
Yes. So what I will do is if we have the page on our Resident Family Support Council page through Illinois Department on Aging, that link has been put in there, but Stephen, maybe you can stick it back in there again. And I will make sure that those slides get put right with the presentation, so that it will be nice and easy to be able to get to that. And we can also put the link to the plan there as well. That will be that when then it's all
Fantastic.
together. So,
Appreciate it.
okay. Okay.
Great. Thank you, everybody. And wow, what a dynamo group you have here, Lee.
Yes, it's a good group, and I'm really thank you so much, Michelle, for being a part of this today. We really do appreciate you taking the time because obviously this is a very important topic for many, many, many of us, whether we're aging in Illinois, we love someone who's aging, or we work in the aging network. I mean, we've got representation from all of that here today. So I think that that's important. That passion does not go away. So thank you
Be well, everyone.
for being with us today. So with that, I'll go ahead and I will end the recording.